This is Dr. Drew Taft, and this is another Fast Foot Fact. We are continuing this video series on foot neuromas. So we had talked a little bit before about what a neuroma was, and now we'll talk a little bit about what the symptoms are and how we diagnose them. So because a neuroma is involving a nerve, it's irritation around the nerve, the symptoms that come along with it can vary. Some people will start developing just like a soreness on the ball of the foot, typically on the bottom, at the base of the toes. They may describe it as something that feels like they're stepping on something. There's a little prominence down there. They can sometimes start to experience a little bit of burning or numbness and tingling on the ball of the foot. And occasionally those symptoms can involve the toes, and people will then start developing like a radiating sharp shooting pain into the toes, or sometimes it's a sharp shooting pain just on the ball of the foot. It's localized, but nerves can present with a number of different symptoms, but they typically all generally revolve around the ball of the foot at the base of the toes. The more common area is the third and the fourth toes, the base of the third and the fourth toes. And the progression of a neuroma, it varies, but typically the symptoms come on gradually. People might develop some things intermittently, and it may be related to a particular shoe or an activity where they develop some soreness. The symptoms go away if they remove the shoe or they stop doing the activity. But then what happens is that the symptoms continue to develop again. And what can happen is if they continue to aggravate it, that nerve can become more and more irritated and inflamed. And then sometimes the symptoms just continue to persist and become more constant. And that's generally when people will give us a call, because now pain hasn't gone away. They've taken away what they thought was the problem, and it's still there. And that's basically because the nerve has become more enlarged and more chronically inflamed. So now they come in, and how do we diagnose these guys? Most of how we diagnose neuromas is basically clinically. Just by you coming in and us taking a look at the foot, feeling the foot, palpating around, by taking a history from the patient and understanding what their symptoms are, we can fairly easily figure out what's going on. Sometimes we can kind of feel a neuroma, we can feel it clicking in there. If we palpate in a certain way, sometimes we can elicit, reproduce some of the symptoms patients have. There are other ways to assist with diagnoses. Sometimes if it is a little uncertain, we can do some advanced imaging, ultrasounds, or sometimes even MRI can be helpful, although they can be misleading because sometimes even if you have a neuroma, ultrasounds and MRIs don't always identify them. Sometimes we will use injections to help us diagnose. Injections people typically think are more therapeutic, and they are, but if we inject and it helps and their symptoms go away, then that's a pretty good indication that we've identified the area in the problem, and so it can also be very diagnostic. All right, so we talked a little bit about the symptoms, the diagnoses. We're going to come back and talk about how we go ahead and treat these neuromas. Thanks again.